complementary and alternative medicine study by Yale New Haven Hospital revealed that if available, 42% of patients would use acupuncture to decrease preoperative anxiety. This statement sparked my interest and made me wonder, what exactly is acupuncture and how will it relieve anxiety? Acupuncture is a form of medicine that involves inserting needles into the skin as a form of pain relief, usually post-operative. It originated in China and has been around for 2,000 years and is now becoming a medical practice globally, and then has more recently become introduced into the United States. I'm interested in acupuncture as a health science major and will be supplementing this knowledge with credible sources using the Bucks County Community College databases. First, I will be introducing acupuncture and its long history involved with the medicine. Secondly, I will elaborate on acupuncture and its uses in the medical world today. And lastly, I will go over the pros and cons of this form of medicine. The history of acupuncture defines what it is today, along with the positives and negatives associated with it. To start off, I will tell you what acupuncture is and further you on the knowledge of its history. By definition, according to the Funk and Wagnall's New World Encyclopedia, acupuncture is an ancient Chinese medical procedure involving insertion and manipulation of needles at hundreds of points in the human body. Applied to relieve pain during or after surgery or in rheumatic conditions and to treat many other illnesses. How exactly acupuncture works remains uncertain. Some scientists predict that acupuncture promotes the release of enkephalins and endorphins, which inhibit or block pain signals in the spinal cord from reaching the brain. Over 200 years ago, acupuncture was developed based on the idea that there are meridian points in the skin and they are direct pathways to the internal organs. Connecting these meridian points are meridian lines that have qi or vital energy flowing along them. It is said that sickness and disease resulted in a blockage of the qi, and inserting needles into these specific areas would restore the natural flow of the vital energy. Chinese medicine is based solely on the belief in qi, and the root of medical problems are due to the disturbance in the energy. In China, the physical aspect of a disease are not the first things observed, if they are at all. They tend to lead towards looking at the emotional disturbance or stressor as the primary cause. The Yellow Emperor's Classic of Internal Medicine is known to be the first medical textbook in the world and was based mostly on acupuncture as the primary form of healing. This book was found during the Han Dynasty and focused a lot on the balance of yin and yang within the body. The first acupuncture needles used were made out of stone. Later, they were made from various metals, including bronze, silver, and gold. Now they are made out of steel and have electrical signals being sent through them. Now that I've introduced acupuncture and its history, I will elaborate on how it is specifically used in modern medicine. Acupuncture, although it has been around for thousands of years, was not legally practiced by physicians in the United States until the late 1990s. Although it does not always provide results, it is relatively harmless in comparison to alternative drug therapies and treatments. An article from the AANA journal Case by Amanda Fairclough states, acupuncture has minimal to no side effects. The rate of adverse events with acupuncture is reported as 0.0001. Acupuncture's primary use in modern medicine is surgical analgesia. Studies show that if acupuncture is administered preoperatively, there will be a decrease in bispectral index values during the operation. This is basically saying that during surgery, the patient will feel more relaxed and less responsive. There will also be a decrease in preoperative anxiety. Interestingly enough, this also proves true for patients experiencing preoperative anxiety for their children who will be undergoing surgery. Acupuncture can also be used post-operatively to reduce pain and inflammation. The Baltimore Medicine Journal states, it has been undoubted that acupuncture has obvious curative effects in reducing chronic pain in the epididymis, reducing scrotal swelling, and anti-tissue fibrosis, which has been shown by recent studies. In this particular case, they're explaining the ways in which acupuncture is helping those with epididymitis. Many patients and doctors alike are suggesting acupuncture because it is efficient, simple, cost-effective, and can be used to treat a variety of issues. It has also been recently introduced into the U.S. military for acute injuries such as muscle aches and back pains. After a study tying acupuncture as a possible treatment to cause the cessation of smoking to avoid the most preventable death, a death by cigarette smoke, the results were fairly correlational. The tobacco industry article concludes, the results of this study indicate that conventional treatments such as NRT and behavioral counseling, combined with the auricular acupuncture, could be a safe and more effective smoking cessation treatment than conventional treatment only. Acupuncture is used as a treatment method for a vast variety of medical issues today. Now that I have explained acupuncture and its use today and how it originated, I will elaborate on the positive and negative effects. Starting with the positives, acupuncture can be used to treat a wide variety of things. As previously mentioned, nicotine addiction, pain, inflammation, and pre- and post-operative anxiety can be positively affected by acupuncture. A recent breakthrough for the use of acupuncture, and it is used to help control obesity. In the late 1990s, acupuncture was used to help patients with drug and alcohol addictions. The same principle is applied with obesity, which can be caused by an addiction to foods, in particular unhealthy ones. Sugar can often release dopamine, similar to as it does in drugs. In a study by evidence-based complementary and alternative medicine, 100% of participants showed a decrease in waist circumference, which is groundbreaking. This 2019 journal states, the results are potentially impactful for participant health as waist reduction from the abdomen may be particularly predictive of improved health outcomes given that visceral adipose fat storage around the abdomen is particularly predictive of poor health outcomes. And as the issue of obesity continues in our country, this discovery could make a really big impact. There are some negatives associated with acupuncture, the most common one being is that it's all placebo effect. Many people that think that all the positives associated with acupuncture are solely based on the physiological factors that the subject is receiving a healing treatment rather than the needles that are actually doing a healing. Although there are a few statements backing up this statement, they also state that placebo pill has a stronger effect than placebo acupuncture. Measuring the effects of acupuncture depend less on what people perceive the effects are going to be. Today, I first discussed acupuncture itself and its history behind it. Secondly, I discussed the use of it in modern medicine. Finally, I discussed the positives and negatives associated with it from the first medical book to present day. Acupuncture has been used in many ways. In conclusion, whether you think acupuncture is placebo or the most effective and efficient medical treatment available, it should be recognized for its history and variety of treatments.